How common is discharge after a hysterectomy? A slight amount of discharge after a hysterectomy is normal, though anyone experiencing a large amount of discharge should consult a medical doctor right away. Light-colored fluid, clear liquid, and a small amount of brown spotting are all common side effects of a hysterectomy. Bright red discharge, urine that contains blood, and an excessive amount of bleeding are not normal side effects. Directly following surgery, most women will experience a small amount of discharge. The general rule of thumb is not to be concerned with discharge after a hysterectomy unless more than one sanitary napkin is used throughout the course of 1 hour. If numerous sanitary napkins are needed in order to control bleeding, it is wise to speak with a medical doctor. The type of hysterectomy that a woman goes through can also impact the amount of bleeding that one experiences. A partial hysterectomy is the removal of a portion of the upper uterus, while a total hysterectomy involves removing both the cervix and the uterus. A radical hysterectomy is the removal of the uterus, cervix, and a portion of the vagina. Women who have recently undergone a partial hysterectomy may experience a larger amount of discharge than those who have gone through a total or radical hysterectomy. In addition to discharge, some women may experience a small amount of bleeding following surgery. Bleeding of this sort can occur due to surgical scars. Surgery-related bleeding should not continue for more than 1 week following a hysterectomy. All patients should be notified of an expected amount of bleeding prior to surgery. While discharge after a hysterectomy may seem alarming, in most cases a small amount of discharge is normal. If a patient experiences a large amount of pain followed by discharge, this could be a sign of infection. It is also important that a patient does not exert herself too much following surgery, as this could cause surgical scars to swell and ooze. In some instances, discharge may occur many years after a hysterectomy. While this is common, speaking with a medical doctor about any unusual discharge after a hysterectomy is a wise idea. Every woman's body reacts different to surgery, though speaking with an expert about discharge is never a bad idea. A hysterectomy can be a scary experience, though understanding will help provide peace of mind.